Let's head into the afternoon newscast with the latest coming in from China as the latest on novel coronavirus. 4 people have now been killed by the deadly coronavirus that took over the world. More than 218 cases have been detected in China alone, and the number keeps rising. Meanwhile, a World Health Organization emergency panel will meet this week to discuss this SARS-like virus that has spread beyond China. Now, China has confirmed a human-to-human transmission of the new coronavirus.
95%以上呢，都跟武汉的这个有关系，去过武汉呐，从武汉来呀，这个是一个特点。第二个特点呢，就是什么呢？就是它是一个目前呢已经证实了有人传人，是在2个地方，一个在广东，一个在武汉，这个证实了有人传。第3个特点是什么呢？也证实了有医务人员的感染，围绕着一些有新型冠状病毒感染的一个病人，因为护理各方面，所以有14个这个医务人员的感染。
Meanwhile, Chinese President Xi Jinping has said that the virus must be resolutely contained. China's Ministry of Foreign Affairs says that the country is dealing with the situation in the most serious and professional manner.
확진 환자는 검역 단계에서 확인되어 지역사회에 노출은 없는 상황입니다. 항공기 동승 승객과 승무원 등 접촉자는 현재 조사가 진행 중이며
The outbreak happened in the Chinese city of Wuhan. A total of 218 cases have now been reported in China. 4 people have lost their lives following the outbreak of SARS-like coronavirus in China. 1 case has also been reported in Japan and 2 cases in Thailand. The 3rd country to get affected is South Korea, with 1 woman being infected. Not only that, a man in Australia is also being tested for the virus after returning from Wuhan. Let's also have a closer look and understand the virus. Coronaviruses are a large family of viruses that cause illnesses ranging from common cold to more severe diseases like Middle East respiratory syndrome. A novel coronavirus is a new strain that has not been previously seen in humans. Coronaviruses are zoonotic. It means they can be transmitted between animals and people. The outbreak in the Chinese city of Wuhan is being linked to a large seafood and animal market. It suggests a possible zoonotic origin to the outbreak. The World Health Organization has listed some of the common signs and symptoms of the infection, which include fever, cough, shortness of breath and breathing difficulties. In severe cases, pneumonia, severe acute respiratory syndrome and kidney failure. Meanwhile, the Indian Health Ministry has also swung into action. The ministry issued a travel advisory for China and also reviewed India's preparedness. The travellers from China will be screened at Delhi, Mumbai and Kolkata airports. What to do if you feel sick on the flight back to India? Immediately contact the flight crew and ask for a face mask. Now remember to avoid close contact with fellow passengers and follow the directions of flight crew while disembarking. Let's also take a look at the precautions more closely. The World Health Organization has advised people to avoid close contact with people suffering from acute respiratory infections, avoid touching eyes, nose or mouth with bare hands, avoid travel to farms, animal markets or slaughterhouses, and refrain from consuming raw, undercooked meat. Avoid any contact with sick animals or spoiled animal products. Let's also try and get a report from Ground Zero as far as Beijing is concerned. For that, I'm joined in by our correspondent Patrick Falk, who's joining us live from Beijing at the moment. Let's quickly go across to Patrick. Patrick, a very good afternoon to you. Now, for health authorities racing to contain the outbreak, how crucial is the timing since the virus has spread during the Lunar New Year period, a time when millions are preparing to travel? Could this also impact the economy?
Yeah, well, you certainly would have to imagine so, and perhaps that's part of the reason why authorities have been reluctant to share a lot of information up until now. Certainly they've received a lot of criticism about that, but there have been a lot of new developments over the last 48 hours, critical new developments, and particularly worrying, as you say, at this time of the year when a lot of people are on the move. They are visiting family and friends for the Lunar New Year holidays. The holidays start on Friday, incidentally, but already a lot of people are already making their way home. Notably, the most critical New development, perhaps, is that we now know that there is human-to-human transmission, and that means the risk of the disease spreading at this time of the year is just so much greater, and really something that people will worry about at this time. And one of the things that people are talking about, one of the things that health experts have been talking about, in fact, is the possible emergence of a super spreader. And if something like that does occur, then we could see the virus spread much more rapidly again as people are traveling around the country. At the same time, though, one of the country's leading health experts has said that he doesn't think the situation is bad as SARS. He doesn't think it will have the same social and economic impact as SARS did, and that the outbreak can be contained.
Right, it's interesting that you mentioned SARS, but considering cases have been found in other places in China and outside China also, is it not more challenging to contain the outbreak in a world which is more connected than ever before? Also, is the Chinese government battling to change its reputation after it tried covering up the extent of the SARS outbreak back in the years 2003 and 4?
Yeah, well, as I say, people have been quite angry that the information has been so slow to come out. That does seem to be changing over the last couple of days, perhaps because of the directive from President Xi coming out to say that saving people's lives must be the top priority, or safeguarding people's lives should be the top priority. But, you know, one really fails to understand why people haven't been disseminating information more swiftly, and presumably, you know, with more information at hand and experts being able to share it around, it could have perhaps prevented the virus from spreading to the extent that it has already. We learned just yesterday that there are now more than 200 confirmed cases. That was a big jump from just a few days ago when we only knew about 62 confirmed cases in Wuhan. So this is something that, you know, people want to see more. They want more data and more information.
Right. Patrick, what's also grabbing headlines as far as this disease is concerned is its constant comparison with SARS. What is it about this pathogen that is drawing comparisons with SARS?
Well, look, respiratory diseases are very similar in a lot of ways. You have difficulty breathing, people suffer from fever. We're being told that people that have contracted the coronavirus are showing lesions on the lungs, on X-rays. So it does seem as though they're quite similar. Beyond that, we just don't know. And I suppose one of the things that they're not clear about right now is to what extent this might mutate into something more virulent that is more easily transmissible between humans to humans. Because, you know, some of the health experts I've spoken to have said, you know, it's not entirely clear just how transmissible it is, and that perhaps it's quite limited from what they see. That might change in time, though, and that's partly why right now people are really having to step up efforts to try and contain it. We're seeing thermal infrared thermometers in train stations and airports to try and check for people with fevers.
And perhaps it's the lack of research and information about this disease that is actually, you know, creating this limbo of sorts. But tomorrow is when the WHO is expected to convene an emergency meeting to discuss the outbreak. What can we expect to emerge from this meeting?
Well, the WHO is basically going to decide whether or not there is a global international emergency, a health emergency, if you like, and that means that they can determine what steps to take after that, whether or not they need to restrict travel or take other precautions. In fact, the health experts in respiratory diseases that I was talking about earlier has actually already recommended that anybody from Wuhan that has any of the symptoms should be prevented from traveling outside of the city. That's how serious he sees it for the time being. We don't know if the WHO is going to take any more steps than that, but certainly it does seem as though the more you contain people, the less likely there is that the virus is going to spread at this time.
All right, Patrick, thank you so much for bringing us all that information. We'll keep coming back to you. In the meanwhile, you stay safe, stay healthy, and stay guarded.